Hi, I'm Sue Waltermeyer, and I'm a certified child life specialist here at Care for the Kids. So a child life specialist is someone who addresses the psychosocial, emotional, and developmental needs of kids in healthcare environments. And I'm part of the behavioral health team here at Care for the Kids. So my role is to help make sure that our patients understand their diagnosis and treatment in developmentally appropriate ways, and that I help them find ways to cope with the things that might be difficult about their treatment. So it might be helping them cope with having their port accessed, or it might be helping them understand what leukemia is or what red blood cells do. Whatever it is a child needs in terms of understanding their treatment and their diagnosis, I help them with. I don't use the big medical terms that have lots of letters. I make things very simple and understandable for the kids. One of the things that some of our patients have difficulty with here at the clinic is having their port accessed. A port is a central line that's surgically implanted in their chest, so they have like a little bump. And the nurses access that port or that bump with a needle. Now the children have Emla cream, which helps numb their skin so they don't really feel the needle pinch, but still it can be very anxiety provoking to have a needle put in your chest. And we try and really focus on the fact that the needle's not inside their body. It just goes through a little tiny bit of skin, and then it's inside the rubber of the port. But still, it's scary. And so one of the techniques that I do with some kids when they're having their port access is to play Would You Rather. It's just sort of a distraction technique where I pepper them with really quick questions like, would you rather have peanut butter and jelly or grilled cheese? Or would you rather have waffles or pancakes? Or would you rather kick a ball or throw a ball? And hopefully if they're engaged in that and trying to quickly think of what their answer is, they're not noticing so much what the nurse is doing and can tolerate the procedure that way. Other techniques that I use for port accesses is we have Kind VR here, and it's a VR experience that's very calming and relaxing, and it sort of overwhelms the patient's auditory and visual senses so that their other senses are dulled a little bit, and so they think that they're underwater exploring sea life instead of in our clinic getting their port accessed. I often use a puppet to show them how to cope with getting their port accessed, and then the child can be the care provider accessing the port, and the puppet can be the patient, and sometimes the patient can act unruly and the child can coach the puppet on how to be calm, and that helps the child sort of ingrain that technique into their repertoire of techniques. A lot of the things that I teach kids, like magic breath, smelling the flowers, and blowing the bubbles, are techniques that they can use outside of the medical environment as well. And so sometimes I'll tell them, you know, we're using this right now for getting your port access, but maybe if you have a test in school that you're worried about, or you're applying for a job when you're a teenager, or you want to be on the team and you have a tryout coming up and you're feeling worried, doing those magic breaths can help you calm down. So as part of the behavioral health team, I interact with all my team members, my education center people. I can call them and say, hey, I've been working with a patient and I have some concerns about maybe their cognitive development or their language skills, and we have the ability through the education center to kind of access where they might be educationally, and if those sort of concerns have been identified by the school and if they're getting services for them, or if not, we can get our medical team involved to do a referral for some sort of an assessment to help with that. We also have the ability to have our education team come up and supplement some of their educational needs in the clinic when they're here getting an infusion, and so you know, they're great team members to access for activities that might have an educational component to help our patients as well. I work closely with our social worker. We are always collaborating to identify children and families that need additional resources. Sometimes in my conversations with a parent or a child, I might become aware of something that the rest of the team was not aware of, and our social worker can help access services that would help the family with that particular issue.